Hey guys, Dr. Steve here at DiMartino Chiropractic in Chesterfield. Today we're talking about a condition called lower cross syndrome. Now what that is a dysfunctional musculature in our body pertaining to the lower part of our body, including the pelvis, the hips, and the lower back. Now we get specific muscles that are tightened and overactive, and then conversely opposing muscles that are weak or underutilized and not engaged. Okay, so what I'm talking about is, if you can also see here, if you were to draw a X in our lower portion of the body, certain muscles get tight. That's our hip flexors, okay, our iliopsoas, our rectus femoris, part of the quads, and then also the lower portion of our back, okay, specifically the muscles that go up and down along both sides of the spine there, okay. And then on the opposite, we have the abdominals here, and then the glutes in the back, and those get weak, okay? So we have that imbalance of musculature going on, all right? So when patients come in the office, what we're noticing is when we have the tight hip flexors, it's actually pulling on our pelvis and creating an anterior pelvic tilt. Now what I'm talking about is we have a neutral pelvis here. What's going on is we're getting the pelvis to tilt forward like this, all right? And consequently, we're getting the lower back to have that excessive arch, all right? And ultimately, that's actually going to create weakened abdominals and weak glutes here. So we're not engaging the core or the glutes there, okay? So what we're noticing here in the office, when that happens, obviously these joints here, the SI joints, okay, where the pelvic bone and the tailbone meet, these aren't moving properly, okay? We're getting dysfunction here in the joints, and that can stem to multiple things going on. We can get problems in the lower back here, pinpoint problems here, and referral problems into the glutes as well, okay? We need these joints to be moving with basically everything. Walking, standing to sitting, sitting to standing, any type of specific movements going on, okay? We need these joints to move. We're also seeing, when we have this lower cross syndrome going on, is your hip flexors actually, well, your iliopsoas specifically, actually connects to the lower back, okay? So when we're getting this pulling effect, we're getting a lot of low back pain because it actually connects to the lumbar here, okay, the low back area. So we're also seeing restricted movement in the L4, specifically L5, the lower back here. All right, so our job as chiropractors is to see what's moving properly and what's not, okay? So when we see this restriction here, we would apply specific adjustments to make sure these bones are moving properly, okay? And then restoring proper motion in those segments, and to relieve symptoms, as well as restoring motion, flexibility, and ultimately strength as well too, okay? This is a neuromuscular problem, so when we're having these conditions, it's affecting a lot of things going on, okay? So when patients come in the office, we do some specific orthopedic exams, check the range of motion. We also take lateral films of the lower back so we can see how excessive the anterior pelvic tilt is, as well as the tailbone, and that just helps us further identify what's going on and to assess the whole lower back, okay? So if you guys are dealing with this problem, if you or know anyone, please contact the office. Click the link below, all right, to access our new patient special offer. We'll hope to see you in the office, and hopefully you can get this corrected. All right, guys, have a great day.